Hey everyone, Ali here. So let's talk about dental board complaints and how these occur. So we are seeing an uptick of these, and it's important to kind of talk about it a little bit. If any of you have ever, watched any of my presentations on dental board rules, you'll know that these are kind of highlighted in those. But let's go through those because we're seeing a lot more of these. So the first thing is, what do they investigate? So in some states, the dental board investigates all matters that come to them. In other states, like California, for example, they don't follow up on financial complaints. If patients have issues with their bills or whatnot, they don't get involved in that, but they will get involved with other matters. Typically, in my experience, if someone has a financial claim against you, they will also have other claims as well that they bring on, usually malpractice or otherwise. And so the dental board still can get involved there. The next question is, who can file a complaint? Well, anybody can file a complaint. It can be anonymous, it can be by a patient, it can be by an employee, it can be by a competitor sometimes. So anybody can file a complaint, and the dental board, because it is a public entity and because it is its main goal is to protect the citizens of the state, they will investigate all complaints. Now, if it's an anonymous complaint, a lot of times they will, upon an investigation and a response by you, sometimes those get dismissed if there's no proof of it, because they understand it's anonymous, nobody wanted to attach their name, they can't follow up with the person, so they take your word for it. Sometimes if it's not by a patient or employee or otherwise, they will investigate it much further, but they investigate all claims filed against them. And so what kind of disciplinary actions can the dental board bring? Well, they can bring all kinds of disciplinary actions. It can be from a private reprimand. It could be a public reprimand. It could be license suspension, which is sort of the worst scenario. You could lose your license. You could be on probation. So they have a lot of leeway. And what the board does is they look at a lot of different things. They look at the actual infraction. They look at what you did to remedy it once you find out that you were violating it. They'll talk about the frequency of it, and so these are all things that matter. And then, of course, how it impacts the citizens or your patient. Are they under continued threat or not? And these are important things for you to keep in mind. Now, what should you do if you're contacted by the dental board? Well, you should ignore it. No, I'm kidding. Of course not. You should not ignore it at all. You should 100%, immediately jump on it. Contact someone like me with experience with these dental board matters so that you can figure out a way of responding to them. This does not go away if you ignore it. In fact, it gets worse because they have deadlines. They may end up showing up in your office, which is never a good thing in front of patients. So if you get contacted by the dental board via letter, immediately, contact someone to help you draft a response. I know it seems sometimes mundane, and you go, oh, well, I'll just respond to them and it'll go away. It doesn't work that way. They will continue investigating it, especially if they think that you're not taking it seriously by writing the letter yourself, by maybe not making it a full letter, by having spelling mistakes, grammatical mistakes. All those things just further complicate the matters for you. So please make sure you take it seriously from the very beginning. The investigation process sometimes is very secretive. So they will ask for information from you. There's no doubt about that. Sometimes if it's about a patient, they might ask to see records, 25 to 75 patient records. They'll analyze those, and then they'll send you their findings. Sometimes it's much more secretive than that, in the sense that they speak to former employees, they speak to former patients potentially. They might do a lot of other things before they really come up with their findings with you. And so we've had situations where the dental board has investigated our doctor for a year and a half, gotten all this evidence, and then filed a complaint, or had the police and others kind of raid the offices. And so it can be really, really scary to get involved in. Now the dental board has a couple of different ways that they can do these investigations, and it really depends on the severity of the matter, right? Severity of the case that they are investigating. If they are sending you letters regarding patients, it's because a patient complained about you, or a not a referring doctor, I'm sorry, a competing doctor, complained about you, and now the dental board is looking into it, and they'll usually ask for these records because they want to see what you have and how good your records are. The more detailed your notes, the more detailed your intake is of the patient, the better off you are. The less professional you look, the less it looks like you are taking matters seriously and not protecting the public, the more of a problem it will be. And as I mentioned, the dental board does not go away, right? You cannot ignore it. It will continue coming, and it'll only get worse. It will only get worse. One of the scariest things our doctors experience is when the dental board investigators show up to their offices. And sometimes, by the way, it's random, right? They've gotten a complaint, they happen to be in the area, and they'll show up, they'll show you their badge, they'll show you their gun, they'll do all those things to kind of scare you and put you in a position where you have to, you're fearful and maybe say something wrong. But my recommendation there is try to be calm. Talk to them, tell them you're busy right now, but you want to talk to them, and then make time for them at a later point with hopefully counsel, so that you are prepared for that meeting. Okay, so just kind of keep that in mind. Sometimes the investigations, especially as I mentioned, if they're anonymous, can be a little bit more informal, but remember, nothing is truly informal with the dental board, even though it may seem like it, because they are taking all that information as they make their decisions on what to do and how to investigate. So common mistakes to avoid is not taking the complaint seriously. That's number one by far. Ignoring or missing deadlines. I can't tell you how much that upsets them. Getting extensions and whatnot are commonplace, and we've had a lot of success getting that from the dental board. So don't be afraid of those. But missing deadlines or going to the last minute and then asking for it, hugely problematic. Don't admit anything, right? Don't admit anything until you've had a chance to look at all the files and everything else. Before you do anything at all, make sure that you're looking at the entire scenario before you're saying anything, and that is an important part of being able to have a cohesive answer to them. If you admit to something and you didn't realize then it can come back and haunt you later. Avoiding your responsibilities by responding to them in an angry or emotional tone never helps. The dental board is not scared of you. They have a lot of power. They have your license in their hands. And so it never helps to be angry or emotional about it. You got to be systematic and objective. It is, of course, an emotional time because no one likes to get a letter from the dental board, but responding in a logical, objective way really does becomes effective and can get you to the right place, especially if you do it with a third party and doing it more professionally. Not responding to every charge. We see that some people, they might have 6 charges against them, they ignore 2 of them and they just focus on the other ones. You have to answer every one, good or bad. You got to make sure of that. And then the last thing I'm going to say, which I leave for last for a specific reason because I wanted to stay with you. Please make sure you never destroy, alter, or in any way change the records of your office. Even if you are doing it, with all good intentions, you forgot to put something in there or you're just correcting something. Don't ever do that after being notified by a lawyer or the dental board that there's a complaint against you. It will be seen as being negative and will be seen as an intent to deceive. So never ever alter those. Let us work through the rest of it, and we can put you in the best light without having to do any of that. All right. If you have any questions, if you ever get contacted, let us know. We're happy to help you through it. Thanks.